At O Positive, we like to say we exchange the art of medicine for the medicine of art. What we do is we come into a community and we get local providers to take off their labels. You're not an artist, you're not a musician, you're not a doctor, we're all neighbors. Together we create stronger and healthier communities by letting people understand the value of art and music. So at O Positive, all of the artists and musicians exchange their talents for medical and wellness services. The community supports that by giving what they can, but we also give back to the community by putting up huge public health expos where everybody has access to every nonprofit in their community and access to care through things like cancer screening, HIV testing, and lots of fun stuff too, right? Lots of things like music in the street, and it really becomes a community wellness event.
My name is Elizabeth Gross. I'm a yoga therapist, and I've been collaborating with O Positive for about the past 5 years. This is my first year doing classwork. I just taught a class, Therapeutic Yoga for Artists and Musicians.
I just got to take a yoga class specifically for musicians and artists. We worked on the energy and the power in our hands and our arms and opening up our chest. So I will say I feel pretty good right now.
Some of the things that we do for the community, for instance, are things like Narcan training. This year we did a number of Narcan trainings right where our home base is.
So Narcan training is so important to our communities because Ulster County, Orange County, Dutchess County are the leading areas of opioid overdose death for ages between 20 and 50 years old. You can imagine more people have died of this opioid overdose crisis than died in Vietnam. O Positive contacted us to come and do the Narcan trainings on the street as opposed to doing it in a classroom to try to catch people that are walking by, because my belief is that most people don't believe that they need a Narcan kit because they don't know anybody who's using drugs. And the truth is you don't know. I didn't know. I had a Narcan kit in my house. I never expected to use it on my son. I had no idea. So I just encourage all the parents, friends, mothers out there, please get a Narcan kit and talk to your family about it.
I am a family physician, and I have a not-for-profit called Go.Go that we started about 4 years ago. We were doing cervical cancer programs in Africa and then also in Haiti. And then about a year and a half ago, realized cervical cancer was increasing in the United States. And then it was mainly among people who weren't getting tested. So we started thinking about this new test called HPV that people could do, and that you didn't actually need a doctor to collect it, that people could self-collect it. The hardest thing, though, is trying to get women to realize it's very easy and simple. But then when women do it, they come out of the box and they go, "That was awesome! I can't believe how easy and quick this was." There's a lot of ways in medicine that hopefully we can get more and more self-care so that people aren't relying on physicians and other people to do things, and I think it's empowering.
I think it's really important because we all have so many gifts to share with each other, and my soul gets fed by listening to music and by viewing art, and by us exchanging with each other in these beautiful ways we allow us to be more soulful, loving people in the world, and we can do that in community, which I think is brilliant.